Hi YouTube, welcome to my channel. This is Dr. Erica, Pharmacist-in-Charge here on YouTube platform. Please like, share, and subscribe if you haven't already. My main channel, Erica Onikbolo PharmD. This is a supplemental channel where I also talk about pharmaceutical innovations, but I mostly focus on Bible education, inspiration, as well as nutritious, delicious foods and travel. I also focus on semi-retirement life, and I want to share more of a recreational side of Dr. Erica. So please like, share, and subscribe if you haven't already. My main channel is mostly going to focus on disease state management, pharmaceutical medications to help with those diseases. I also focus on nutrition, smoking, tobacco cessation, as well as weight loss management. So if any of that sounds good to you, please visit my channel, like, share, subscribe, so that you will receive notifications. So today I want to talk about the new 2026 season upcoming. We're going to have World Autism Day, which is scheduled for the 2nd of April. So autism is more prevalent now that we understand it in the 21st century. When I was in pharmacy school, we talked about mental health. We talked about ADHD, PTSD. We talked about those disease states where the mental health is usually compromised and what medications we use typically to deal with management and better outcomes for daily living of each individual patient and their families. So now that we have more information about autism and the disease of autism, we're better able to do behavioral skill management, cognitive therapy. We're able to do more interaction, and we're also able to manage more precisely the medication regimens that are prescribed. As pharmacists, we are always available when dispensing and reviewing drug interactions, medication to medication interactions, also allergy interactions, as well as managing any type of food drug interactions as well. That could be a possibility. And we want to make sure outcomes are always in the um, on the side of the family and the individual patient. When you are dealing with a community pharmacy, you're able to speak with your pharmacist, you're able to talk with them, get a better understanding of how medications work, how medications may cause a side effect here or there, how medications treat, how they actually leave the body, and what they do while they are being consumed, absorbed, and distributed throughout the system of the body. So we are availably, we're ready, we are successful in our education, and we want to share that with autism patients and their families. If you are someone who is needing more information about drug therapy pertaining to the management of an autistic patient, then do make an appointment with your pharmacist so that they can give a comprehensive therapy management that is understandable, that is readable, and that can be applied every day. So, again, April 2nd is Autism Day here, 2026. And I want to make sure that I play my duty as a pharmacist in charge to relay what we can offer to community uh, patients in a community setting. I have been a pharmacist for 13 years. This year in October, I will have been a 13th year licensed registered practicing pharmacist where I actually dispense medications. I give auxiliary immunizations. I also am able to collaborate and sit down and talk about medications. There are ways that you can do that, and that is through appointments, or you can just simply walk in at any time and make an appointment if needed. Some causes of autism from medications have not always been 100% for medications like Tylenol, for immunizations, for pediatric patients. Those have not always been confirmed 100%. I do recommend you move ahead with whatever decision you decide for your individual autistic patient. As a caregiver, as a family, as someone who is looking for the best outcome for the individual. Again, pharmaceuticals have not decided on an exact cause of autism from the use of any branded or generic product that we dispense. So that's what I wanted to relate on today's topic of autism that we're going to dive deep into on the 2nd of April as we celebrate and commemorate the importance of finding out the true origin, if you want to say, or the true cause of autism. And we are, as healthcare providers, continually moving forward with finding the uh, resolution to any particular outcomes that may be uh, the opposite of what we're looking for. And we want to make sure we are concise, we are truthful, and we are relaying the right message. So do please be aware, April 2nd is coming and it is Autism Celebration Day. So please like, share, subscribe for more information. I hope to see you on future videos. And again, this is Dr. Erica, Pharmacist-n-Charge on your YouTube platform. Take care. Bye-bye.